Are like motor vehicles. Cars use motor oil. At least some of us use pharmaceuticals. They come from the same, from petrochemicals. Some petrochemical drug manufacturers are Procter & Gamble, DuPont, Merck, and Lilly Farm. Also includes production of methadone. Methadone is a medication used to relieve severe pain. It is also used to prevent withdrawal of symptoms in people who are addicted to opiates, such as morphine, hydrocodone, and fentanyl. Dolophine and methadone are two common methadone drugs. Methadone is a medication used in assisting people to reduce the use of heroin. Methadone has been on the market for a long time. The pain relief effects last about 6 hours for each single dose. Side effects are constipation, nausea, sleeplessness, vomiting, tiredness, headaches, and drowsiness. Serious side effects are irregular heartbeat, depressed respiratory function, tremors, unstable gait, fainting, seizures, anaphylactic reactions. Long-term use of methadone is cardiovascular issues, potential having collapsed vein due to injection, respiratory issues, COPD, menstrual cycle changes for women, sexual dysfunction for men, and issues with judgment. Effects of methadone on the body. Drowsiness, short-term use of methadone is drowsiness, shallow breathing, reduced cough reflex, reduced pain, dry eyes, nose and mouth, decreased blood pressure. Long-term use of methadone on the body is constipation, small pinpoint pupils, sweating, itching, bone pain, and teeth damage. My experience with methadone, I worked at a methadone clinic for several months. They open during the week from 5:30 a.m. to 11:30 on weekends. They open from 6:30 to 9:30. There are about 250 people that dose during the week and 100 people that dose on the weekends. Patients line up and have to swallow. Line up at the window to show. They have to show an ID. When they dose at the window, they get a liquid called methadose. They would have a certain dose that they would were prescribed. We had to see them swallow, open their mouths. They had to speak to a counselor every week and had to do a drug test every month and a random if it came up on the computer. If they did not show up to the dose, they were put on an AWOL list. If they were put on an AWOL list, they had to speak to a counselor to see what happened, why they did not show up for dosing. After so many AWOLs, their dose was lowered. Some patients obtained privileges. They would be able to take doses home and not come in every day. These patients had to have a lockbox. Some patients had small children, and this is deadly if they get their hands on it. My husband worked there at one time, and he had a toddler ingested the medication and died. I understand they are on medication to get off addicted drugs, but isn't this drug addicting too? I have seen these patients wean off the next day but go back up on the drug. The nurse I worked with was there 5 years. She said of all the years she's been there, only 5 people get off the drug each year. Government spending on methadone. Methadone clinics vary from state to state depending on funding availability. 60% of people seek drug treatment have no insurance. Battle of opiates may be on their own. Methadone is a class 2 narcotic. Funding is dependent on location, nonprofit versus profit, residential versus outpatient, income levels of patients if the patient has health insurance and what the health insurance will cover. PA spends about $5 million a year on overdose reversal drugs, Narcan. For example, in Middleton, Ohio, spends an average of an ambulance run for an overdose victim $1,400. They have 916 calls in 1 year. That's cost their budget $1 million out of their $30 million. It is sad. My daughter worked at a Dollar General, and she asked why they did not perform drug tests, and they said that no one would pass the test. I hope we stop this epidemic of this drug. There are many lives that can be saved.